UK Healthcare Community Connection is sponsored by UK Healthcare.
Welcome back. Dr. Sonu Abraham joins us on the couch for our latest UK Healthcare Community Connection. This morning, she's taking a closer look at our hearts.
Dr. Abraham, you treat patients with a unique variety of heart conditions, heart failures. Can you kind of give us some examples and how they affect patients?
Sure. Thank you for having me here. My name is Sonu Abraham. I'm a heart failure and transplant cardiologist. So heart failure is essentially a disease where people develop symptoms like shortness of breath. They have swelling in their legs, chest discomfort, and that's due to either a low heart function or the heart is too stiff. So I run a clinic called the Hypertrophic and Infiltrative Cardiomyopathy Clinic at University of Kentucky, and these are specific diseases that need specific kind of treatments, and it's a specialty clinic.
What does that specialty treatment look like?
So hypertrophic cardiomyopathy in simple terms is a genetic disease. It affects the heart muscle, causes thickening of the muscle of the heart. And that can cause an obstruction of blood flow out of the heart. And that can cause people to get lightheaded, dizzy, short of breath. And so there are various treatments that you can offer these people, which includes medications, but it can go all the way up to interventional procedures and even surgery. So we are able to offer all of this at University of Kentucky.
When it comes to the treatment options, does age play a big factor into what you decide to do, or what are the factors?
That is interesting because hypertrophic cardiomyopathy tends to occur in people who are younger, like 30, 40, 50. But if you look at the other spectrum that I take care of, like the infiltrative cardiomyopathy, the age group is actually 60 and above. So the treatments for different diseases are, different, and the age groups are also different. But age by itself does not stand in the way of specific therapies. We do consider certain things like, okay, if they're older, they might be higher risk for surgery or procedures. If they're younger, they're lower risk. Those things do come into consideration, but these different diseases, hypertrophic cardiomyopathy and infiltrative cardiomyopathy, infiltrative includes diseases like cardiac amyloid and cardiac sarcoid. Those have specific medications and therapies which we are able to offer.
Your interest in this field, at what age did it start?
In cardiology, actually, it started when I was in 8th grade.
8th grade.
Oh my gosh, 8th grade, I was not thinking about this, but clearly it must be a rewarding career path.
Yes, it is a very, very rewarding career path, and I think here in Kentucky, it is especially rewarding because you get to offer specialty care to the people of Kentucky, and the people of Kentucky need this care. And we can offer multidisciplinary care here. Certain diseases like cardiac amyloid sometimes need a neurologist, they might need an oncologist, they need a cardiologist. So there's like a multidisciplinary team that can take care of this one patient and offer wholesome care. So that's actually an extremely rewarding thing that I'm able to do at University of Kentucky.
Fantastic.
Paul, Dr. Abraham and I were saying, we were talking beforehand, she just moved here in September from Chicago, and we are very happy that you've come to Kentucky.
Thank you. Thank you for having me here.
It's a pleasure.
Yeah, it's really nice to meet you. Well, that's another UK Healthcare Community Connection. Great information. You saw up on your screen if you want to learn more about this terrific program.
We'll be right back with the final 30 minutes or so after the break.